Hi everyone, I hope all are well, and today we are going to deal with the topic or one of the new paper that you are going to face, that is health psychology. So as we described yesterday, psychology is having different branches. So health psychology is one of the different branch or recent branch that focused on some medical aspects of psychology and how it applies in psychological principles to help or heal the people from the physical illness and some of the medical problems. So here we are going to discuss about some of the, or we are going to give an introduction or an outline to what is health psychology. So what are the main objectives? There will be some objectives to study this area, that is health psychology. So or including such a paper or such a branch in the area of or in the field of psychology, there will be some objectives to be related to that. And when it comes to the syllabus also, there will be some objectives for every paper that you are studying or that we are dealing with. And exactly like that, there will be some objectives of including some of the branches in the broadened area called psychology. There will be some branches like health psychology or social or abnormal. There will be some objectives will be presented. So here also for the health psychology, there will be some objectives to be given to this area, why it is being done or why this area is being done. Okay, so there will be some objectives that is given. That is, first one is to understand the psychological, behavioral, and cultural factors contributing to physical and mental health. And the other objective, that is to study the management of different illness. So the first one, that is to understand the psychological and behavioral and some of the cultural factors. What are the psychological factors and behavioral factors? And there will be some cultural factors also contributing to the physical and mental health of a person. Maybe you can see that many of the behavioral patterns of a person that can lead into some of the psychological issues, some of the physical issues, or maybe some of the mental issues, or it will contribute it into the mental health also. And some of the cultural factors also being making some trouble to the physical health of the person or to the mental health of the person. And so that is why it can be included as an objective here. And the second one, that is to study the management of different illness. So to understand or to guide or to the person or the people who are having different illness, so they have to manage it in a better manner. So how they have to be managed or how they have to manage their physical health as well as their mental health. So to understand these all, there will be some behavioral pattern that the person has to be followed. So how to be managed some different kind of illness. So that is why these are the main objectives that can be given to the area or given to the field called health psychology. And related to the paper, that is the first module of your syllabus that deals with the introduction part of the health psychology. So what are the contents to be followed in the first module includes the first one, that is a definition of health psychology, and it is dealing with mind and body relationship. And the next topic, that is the need and significance of health psychology. What is the need of studying health psychology and what is the significance of studying health psychology? And the other one is biopsychosocial model versus biomedical model. So there will be, that is some of the medical aspect or medical concept includes with the biomedical model and biopsychosocial models. That so these all are the topics that we are going to deal with in the future slides or in the future syllabus. That is, in the first module we are going to talk about these topics. So here we are going to give a definition to what is health psychology. So Here we can see a definition that is given by WHO, that is World Health Organization. That is, health psychology is an exciting and relatively new field devoted to understanding psychological influences on how people stay healthy, why they become ill, and how they respond when they do get ill. So, when taken it as a case, when taken it as a definition from the side of World Health Organization, we can we'll be knowing that every health issues, every problems that are facing by the people, it will be come under an umbrella called World Health Organizations. Okay, so we can it is very clear in the right moment, that is we are facing a global issue, that is coronavirus or COVID-19. So well, we know that we'll be very familiar that World Health Organizations are giving better guidelines to how to stay, how to be safe, and how to be taken care the things in our day-to-day activities. So every health issues that will come, as it is a psychological as well as some physical health, whatever it is, the problem, the health issues that is facing to the people, it will come, or the World Health Organization will play a better role. So they had given a better definition here, that is health psychology is an exciting and relatively new field. That I already said that it is a recent branch that is being added in the area of the broad area called psychology. So it is a new field devoted to understanding the psychological influences on how people stay healthy. That if the person will be staying healthy, so they have to know how the person should be, what are the psychological influences the person gets to get healthy or stay as an healthy case, and why they become ill and why they are getting ill, they have to understand, and how they respond when they do get ill. And the next one, that is when they get ill, how they will be responding, how the people will be, or how the person will be responding to the illness what he or she is facing. That is we can take it as an issue that COVID-19. So the people, or they are trying to, or the health psychologists, they are trying to understand the psychological influences on how people stay healthy. Some of the people are being get into the healthy areas, and they'll be understanding why they become ill, or because they are making some enquiries or making some researches behind these issues, behind these, what are the causes of that, that is why they become ill, or why the person get into the coronavirus, or some of the how it is being affected with the person, and how they respond when they do get ill. That is, we can see that many of the people are getting trouble with the mental health when they get into virus, or some of the coronavirus. The person will be, how the person will be responding, how the person will respond if they came to know that the person is having coronavirus. So that is the area, these are the areas that will be dealing with the health psychology, or health psychologists are trying to be make some research outlines in the area of health psychology. So that is one of the most recent definition given by W Health Organization to the branch called health psychology. Here we can see that the definition given by the APA, that is American Psychological Association. So American Psychological Association defines health psychology in the following way, that is, health psychology seeks to advance contributions of psychology to the understanding of health and illness through basic and clinical research, education, and service activities, and encourages the integration of biomedical information about health and illness with current psychological knowledge. So as we have defined the health psychology by the definition given by the World Health Organization, there is some little advancement that you can see here. That is, the meaning that is given by both, it is same, but you can see that some of the uh, up, updation that you can see here, that is understanding of health and illness through they have clearly mentioned that what health psychology is focusing on, that is they understand the health and illness through some of the basic and clinical researches. So that is why we said in the previous one, that is how and why it is happening. So through some of the clinical researches and some of the studies, that is some education and some case studies maybe, and service activities, and encourages the integration of biomedical information about the health and illness with the current psychological knowledge. So the main area, that is they are adding some of the psychological aspects or psychological concepts behind this course. There will be some causes or some of the psychological issues, or they are adding some of the psychological knowledge behind having these all problems, so that they are understanding through some of the researchers or clinical researchers and some of the education and some of the service activities, they are doing that. And the other thing, that is health psychology focus on more medical aspects of psychology and applies here. What they are doing is they are applying the psychological principles to healing physical illness and medical problems, that we already said it before. And health psychology has grown so much in recent years, that is no longer a field made up of just health psychologists, that it is very clear that this field, especially like health psychology, so it is a club or it is a mixture of some of the other fields also, or they are seeking the help from the different psychologists like social psychologists and some of the clinical psychologists. That is how it is happening, that is how it is happening. It is just health psychology has grown so much in recent years, that we said in before, that is health psychologists only with the health psychologist it will not be getting developed. Instead of clinicians and social psychologists and others all conduct research on health topics, especially here what we are focusing, that is mainly on health issues. So clinical psychologists or clinicians or social psychologists and other all fields, some of the educational psychologists, and they will be conducting researches on health topics. So we can see that right now many of the clinicians and many of the researchers, they are doing some of the research project on how the mental health of the people during this pandemic, during this corona. Right now we can see that many of the researchers are doing some of the uh, research mainly to understand what is the uh, issues or problems people are facing, that is mainly researched on health topics like this coronavirus or this pandemic. So uh, everyone is means in the experts in different areas, that is clinical areas, educational areas, and service activities, or people who are working with social psychologists. So these all others are conducting researches on health topic like COVID-19. So for example, we can say that a social psychologist may conduct studies to determine the different causes of group pressure, while a clinical psychologist may study ways to reduce the stress induced illness through relaxation techniques or some other therapeutic techniques. So that is the difference between that you can see with the social psychologists and some of the health psychologists. So they are pressurizing, or they are focusing on clinical psycho, mainly like clinical psychologists are focusing on the study how to reduce the stress in the people. So that you can see right now many of the clinical psychologists are right now they are trying to reduce the stress with the people who are facing this virus or COVID-19 issues. So sometimes they'll be going for some of the therapeutics or some of the relaxation techniques, and they'll be giving some of the guidelines to how to keep the body healthy. It's just because they done some of the clinical interventions before. So here we are going to discuss about what the health psychology or what is the health psychologist are being mainly focused on. So here we can see some of the points that we have to discuss, that is where this health psychologists are being giving importance. So the professionals in the area of health, that is as we said like before, that is clinicians or clinical psychologists, social psychologists or health psychologists, etc. Here the health psychologists mainly focusing on the health promotion and the maintenance. So that we said it as a objective in the starting related to the health psychology. What is the main objective is to study this area, that is the maintenance of the health or the maintenance of the health promotion, so, or the mental health as well as the physical health. So health psychologists focus on health psychologists focus on health promotion and its maintenance. And the other one is health psychologists study the psychological aspects of the prevention and treatment of the illness. So that is another area that health psychologists are being studied. That is, they study this, what are the psychological aspects of the prevention of the illness, and what are the psychological aspects we have to take in care to prevent the these all illness or the problems or issues or health issues, and how to, and the treatment of that illness, also psychological aspects of the treatment of illness. So that is the areas that health psychologists are being studied. And the health psychologists also focus on the etiology and correlates of health, illness and dysfunctions. So we know that etiology, that is the investigation or attribution of the cause or reason for something. So that is health psychologists are focusing on, they are investigating, that is uh, and the other thing, that is we can see that the health psychologists analyze and attempt to improve the healthcare system and the formulation of health policy. So I think this is the area that it is current situation is being under this analysis, I think, by the health psychologist or social psychologist or a group of medical care trainers. That is, health psychologists, they are trying to analyze and attempt to improve the healthcare system of the person or the people, and they are trying to formulate some of the health policies. So this is, so what we are doing right now, that is wearing the mask or keeping the social distancing, like some of the activities, that is we are taking some of the prevention methods. So it is as part of the formulation of some of the health policies what we are making, and we'll be and they are trying to improve the healthcare system of the entire system, like medical system of the nation or medical system of the state, or it is being connected with the healthcare systems. So here we are going to discuss about what health psychologists do. So we heard the word or we are familiar with the word health psychologist and health psychology, and what they are trying to do and how do they work. Okay, so these are the two important points that we have to discuss about when we are talking about health psychology or health psychologists. Okay, so how health psychologist works, that is their main area is to empower the patients. That is, health psychologists provide tools and teach their patients new skills so that they can learn to help themselves. Instead of patient, we can use the word client. That is also that is a word that we are using right now. That is the client can develop new skills so that they can learn to help themselves. So, and a health psychologist's role is to provide information. So the other thing is, the health psychologist or a health psychologist's role, what is the role, is to provide information so that patients can ultimately make their own informed and conscious decisions. That is or the clients can make their own decisions, or their own informations and their own conscious decisions they can do. They are not in the they are aware of their decisions, they will be aware of their decisions. And the other area that we have to discuss, that is how they works, how this health psychologists work. So we said that before, health psychologists work on they'll be collecting, or it is an interconnected area that we said before. That is, health psychologists work on multidisciplinary teams in integrated care settings, include or including work with physicians, like clinicians, or some of the nutritionists and dietitians, or some physical therapists, or some other people that who are dealing with the mental health as well as the physical health. So these are it is a multidisciplinary task, and health psychologists work along with these different branches, so that they can what is happening here, that is they can discuss and share some of the relevant information to best serve their client. So an health psychologist can understand the details from nutrition, so it will help the health psychologist, and they can collect some of the things from the clinicians or physicians. So this all will help the uh, health psychologist to work out. In addition to they can also help the doctors also here with the patient compliance and personality conflict between physicians and their patients. It can be happen, there will be some conflict that can be seen with the doctor and the patients. So here also the health psychologists have the role, that is health psychologists working alongside with these providers on a regular basis in these settings have a unique opportunity and potential to really help the providers as much as they do with the patients. So that is, we can see that in the hospital settings or some of the areas, there you can see some of the health psychologists, so that they will help the patient or help the client to deal up with the physicians. So they will inform some of the areas, some of the psychological or some, that means that they will understand the patient, they will try to clear an outline or clear idea about how it is happening, what are the cause, and what are the treatment, why these treatments are given. So the patient or the client can have a better understanding about that. So in every hospital settings or some of the areas, the health psychologists are having a good role, and that is the reason why they are working in a multidisciplinary task, that is including all the medical people like physicians or clinicians, and also the health psychologist will be collecting the details from the area of social psychologists also. So these are about these are all about the for the today's class, and we'll discuss the topic remaining topics in the next class.